Can you read that? So this might be how somebody who's having problems with the spacing of letters, flipping their letters back and forth, spelling problems. So if I asked one of you to stand up and read that, and it was doing that, so the person in this probably has a vertical misalignment of their eyes that's only there once in a while, and poor eye movement control, and of course somebody's going to have a really hard time learning to read, let alone reading to learn. So eye movement problems, and I have, Jane? Yeah. Do you have that little sheet that they can see that has the eye movement? I'm going to give you a little demonstrator.
You have it right there.
Okay. So this is kind of like trying to demonstrate what somebody that has an eye movement problem might experience. And Vicky's handing out the sheet, and what you're supposed to do on the sheet is you're supposed to read up and down rather than side to side. Try to read that out loud with any fluency. It's really hard. See how slow, laborious it is? So, some symptoms, I'll let you look at that for a minute. So some symptoms that a child or an adult that has eye movement problems may have would be moving their head back and forth instead of moving the eyes, because they're and losing their place often during reading. They need to use a finger or a marker to keep their place. They misalign the numbers or digits and columns, omitting words, rereading or skipping lines unknowingly, and displaying a short attention span for reading or copying. If you have eye teaming problems, you may report blurring or doubling, but only when the work is hard, so it may not be all the time. Repeating the letters and the words, again, misaligning digits and numbers or columns, squinting or covering one eye or closing their eye, tilting their head extremely while working, and that's often to get the nose in the way so that they don't have to use both eyes. Poor posture when doing near work. It's just hard, very slow reading speed. And occasionally or persistently reporting seeing double or blurry when reading. If you're a parent or a teacher and you hear a child ever report double vision, they need to be seen by a developmental optometrist, because that should never happen. They shouldn't ever see double. And most of the time they don't report this. In fact, I've had parents where I'm doing an assessment and I'll ask the child, not the parent, the child, do you ever see double when reading? And I've had like 13-year-olds say yes all the time. And the parent will just like drop their mouth because the kid has never told them that. And and some of the kids will say, well, I have two eyes, I thought that was normal. So if you don't know what normal is, you're not going to
I found it really interesting that Will never used words that I would identify with, double or blurring. He said it disappears. Mm-hmm. It disappears. And I was like, honey, just read it. Stop making it disappear. Well, look, I can make it disappear. I can make it disappear. Make it disappear.
Yeah.
I didn't understand what he was trying to say because it wasn't the adult terms.
Yeah. So here's somebody that might be having a convergence problem where it's kind of going in and out a little bit. Oh yeah. So here's examples of double vision problems. This is a vertical double vision, and most of the time you don't see this unless somebody's had an accident, but it's very common in brain injury or stroke to have a little vertical component, and it can be very, very debilitating. Usually they don't see this all the time. It just goes in and out, in and out, in and out. These guys have some problem, some vertical. So focusing problems, so they may be squinting to see the board, and again, so they go into the eye doctor and they have 20/20 vision. Why are they squinting to see the board? Because they looked here and it took forever to get their eyes to clear up and look far away, so that's why they're squinting, or the other way around. Short attention span. I had a parent years ago, this is really sad. I had a parent that came in and brought her child to me, and she's a personal friend. And she said, the teacher's just saying she's not paying attention, she's really misbehaving, and I've been punishing her. And she was really farsighted. I mean, 4.5 diopters farsighted. And when I told her, she broke down and cried because she felt like she'd been punishing her kid for something that wasn't their fault. And did much, much better with the glasses, but it was sad that she had to wait that long. Comprehension reduces as reading continues, loss of interest in reading too quickly. Fatigue, this is very, very common. Errors in copying from the board, laborious reading, this kind of thing. Sometimes it's the parent doing that. Holding the book very close, getting the head really close, good vocabulary but poor comprehension, avoids near-center tasks. Headaches is huge. Headaches all the time after they read. Burning or itching eyes after doing near vision work. And this is not only kids, this is adults too. I have a lot of adult patients that have vision therapy because of really bad headaches, and they have really bad accommodative problems. Excessive light sensitivity is also a clue to accommodative problems. And then vision perceptual problems, they're mistaking words with similar beginnings, reversing words, letters, or numbers. Confuses likenesses and minor differences, fails to visualize, writing up or downhill, poor letter or word spacing, frustration with homework. There's that parent. And then the physical symptoms, they may have headaches and eyes burning or watering, blur at far or near, during or after reading, double vision, letters seem to float or move, frequent blinking, squinting or tearing of the eyes, one eye turns in or out. So this is kind of just a brief slide to show some of the activities, the common activities that we might be doing in vision therapy. So the top one here with the string, that's a Brock string activity, very powerful, very simple but very powerful. The little boy in the center is doing chalkboard circles, and this is what we do sometimes for those kids that are kind of lost in space. They don't know their left and their right. They just don't have a feel for what's going on. The little girl with the pegboard is got flippers, so she's doing a focusing activity as well as a hand-eye coordination task. The little boy with the computer is doing a eye teaming task, and we have a couple of computers in here that work with that. It's very nice because we know that they're seeing it, because you get a score, and if you can't get a score unless you're seeing it with both eyes in a three-dimensional way. And then the little girl there is working on a stereoscope, and we use a lot of stereoscopes here. People take those home all the time as part of our therapy. And of course, the ultimate goal is to make people the most successful that they can be, whether it's graduating from college or just becoming the whole person that you're meant to be. And that's, that last slide, that's why I do therapy, because I love to see changes in people. But it's hard work. I mean, Mark will tell you, we got on his case because he wasn't doing his exercises at the start, remember? And you have to be consistent. It takes a while to train the brain, especially when there's less elasticity as we age. The kids, the changes are a little bit faster, but we can make lots of changes at all ages. So, any questions for me?